Wow. Okay. Let's start with a fact. Did you know, on average, surgeons only get less than 6 hours of sleep a day? Is this really who you want to operate on you? Currently, doctors have to work 36 hours on call. This would be intolerable in any other industry. And yet these on-call hours, they don't count as overtime. We have to look at these doctors and we see residents spending their nights in hospitals. We see senior doctors, they are restricted and limited to a small region around the hospital. But after 35 hours of being awake, can we really expect these doctors to perform their best? Research has shown that sleep deprivation results in an impairment of concentration and decision-making. Both skills are extremely important when it comes to a life or death situation. Sleep deprivation, which is less than 7 hours in bed, was found to be common among doctors, and in fact increased with the amount of hours that they spend working. And these prolonged working hours, it was seen to be directly proportional to the amount of medical errors that were created, and it was seen to be directly proportional to poor work performance. And yet, these doctors have been reporting that those who work over 65 hours a week, 14% of them once fell asleep during surgery. And at the same time, we can see that the amount of medical errors also increases. Because for the doctors who work for 50 hours or less, it's 21.8%. But for those doctors who are working over 65 hours a week, this increases all the way to 36.2%. But this isn't the only problematic issue. The other relationship is with working hours and mental health. Junior doctors, a quarter of them, have to work unsafe hours. And these unsafe hours, they double the risk of these doctors developing mental health issues, of developing suicidal ideation. If the role of a doctor is to save lives, is it really worth the cost of the mental and physical well-being of our doctors? And sleep deprivation is a pervasive issue that affects the entire healthcare industry. It's not just surgeons. Doctors, because of sleep deprivation, will find their empathy, their compassion diminishing. And this leads to a decline in the patient care quality. Compassion, empathy, these are super important skills for a doctor. But what we should be focusing on is supporting the mental well-being of these doctors. Healthcare is a collaborative industry, and no doctor will be able to succeed without all the teamwork and the supportive effort of all the other medical professionals. A doctor can never succeed without the support of nurses, paramedics, allied health workers, because no matter how resilient a doctor is, they will never be able to mitigate the issues of sleep deprivation on their colleagues. Let's take nurses, for example. Nurses have the role of monitoring patients and making swift decisions. If a nurse is unable to get the sleep that they require, fatal errors could occur. The nurse could accidentally administer the wrong dosage. And simply consider another scenario with paramedics who have to drive ambulances. Imagine being in a car accident and suddenly you have to face another because the paramedic behind the wheel has been working for hours non-stop. It is scenarios like these that underscore the urgency to address this issue, not just for doctors, but for the entire medical team. It is vital that we focus on helping doctors and the entire medical team to ensure that we have a healthier future, not only for us, but also for the entire healthcare industry and for patients. We want to increase the quality of care for patients too. Now, this health issue affects doctors so much because with the sleep deprivation, it contributes to obesity, it contributes to diabetes, it contributes to cardiovascular diseases. And yet, the sleep deprivation that affects doctors weakens their immune system. The immense pressure that they face weakens their immune system. They're once again more susceptible to all of the diseases that they could catch. We are pushing doctors so far, and yet the doctors will not get the support that they need. This jeopardizes patient care, jeopardizes patient safety, and lowers the quality of care once again. And this brings numerous challenges to the entire healthcare industry. If we focus on it, we can see that this is just a symptom of the wider issue that affects the entire healthcare industry, that there is a crisis that we don't have enough doctors. There is an acute shortage of all medical professionals. Globally, for every 1,000 people, there are only 3.5 doctors. And this shortage, it results in doctors having to work longer hours. Doctors have to keep working to make up for the fact that there just aren't enough of them. And this goes for all medical professionals. And this brings so many challenges as patients have to face longer waiting times. Patients themselves, they have to face shorter times with these medical professionals because the doctors have to go through cases much quicker to make sure that everyone gets the care that they need. And at the end of the day, what do we see? Healthcare costs continue to rise. Doctors have to face this issue of having to have so much pressure on making sure that their patients get the best quality care. And yet, this results only with a shortage, and the shortage leads to complications of patient outcomes as the care becomes fragmented due to the shortage. We should be addressing this issue instantly because it needs to be addressed if we don't want the consequences to continue to affect us. And yet, the solution is simple, right? Just like how we can solve poverty by printing more money, why don't we just make more doctors? Well, it's not that simple. Just as an economist will tell you, printing more money brings inflation, making more doctors will compromise the quality. We can look at doctors and we know that they have to all go through medical education before they can become a doctor. And yet medical education is notoriously expensive. And to ensure for quality, it is a highly regulated industry. But because of this regulated nature, there is a limited amount of spots. Yes, the demand to become a doctor, everyone wants to be a doctor. Even if that is the case, it doesn't matter. There's still a limited spot. There's still limited amounts of spaces that we can give to train these doctors. I know plenty of my friends who want to be doctors. And yet, are all of them going to get into medicine immediately after high school? Probably not, because there is still a limited supply of spots. And this scarcity extends to specialization opportunities. So what that you got into med school? You want to become a dermatologist? Well, there are long roads ahead because you have to make sure you beat everyone else who is already at the very top of all of the other competitors and got into medical school. You have to beat all of them just to become a dermatologist. And all this competition results in just even more shortage for specialists. But obviously we can't just make more doctors because we can see this from the strike by Korean doctors, where the sudden increase of almost doubling the amount of doctors that the Korean government is now allowing to enter medical school compromises the quality. It highlights the importance of us maintaining the quality of these doctors. Simply having more doctors does not mean that we will be able to train them just as well in the hospitals. We still need them to gain experience. No matter how well-knowledged a doctor is, ultimately, they will still lack the experience and skill, and then they will not be able to develop and give out proper practice and efficiently. And adding on to this issue, we have the long hours that they have to work along with the demanding workload. Many doctors in public hospitals have already expressed their dissatisfaction with the working conditions and the working hours in these public hospitals. Having to work so long, and yet they only get more and more pressure. So this ultimately pushes them away from medicine. Why would you purposely choose, after all of this time, just to face more pressure? They will move into research. They will move into working part-time. And they may even move entirely out of medicine. And this ultimately leads to a larger shortage of doctors, but more importantly, underutilizes the amount of resources that have been invested. To address this issue, we need to make sure that we can help retain these doctors within these industries. We need to ensure that these doctors continue to want to work in this industry. And we can do that by ensuring that the work quality and the working conditions and the working hours are better for these doctors. Now, adding on to this, we also have got the increase in demand for doctors because overall in the world, there is an aging population. And demand for medical and healthcare will only increase continuously. And as it increases, doctors will face even more pressure to go through an even larger caseload. And ultimately, this will even further worsen the work experience for these doctors. So So what else? And obviously, these aren't the only issues. Some other issues that we can see are the barriers to entry for doctors. Yes, you've gone through medical school, but you may be able to practice in this country, but other countries may not recognize your degree. Countries are now worried about the quality from other universities, even though they had to face so much friction just to enter the medical school. And with this, even if you are a country with a huge surplus of doctors, you cannot contribute to the solution. And ultimately, doctors' shortage is a huge issue and governments know it. So they spend money from the public health budget to recruit more doctors. And what does that mean? That means less money for hospitals to spend to improve the quality of care. So what is the current situation? The lack of doctors, and all the government can do is to continue to ask for foreign doctors to enter and try and attract these foreign doctors. And yet at the same time, while they're trying to attract these foreign doctors, what do? They set even higher barriers to entry. To enter the US to become a doctor, you have to pass a test and you have to get a visa. Okay, that seems pretty high, right? Now let's look at Hong Kong. Test, interview, not only that, you also need to get a recommendation letter from your previous employer, and then you also have got to make sure that you can work in this area and be committed to working in the public health sector only for a limited registration. You're again working for the government for a set amount of time before you can then go out and practice yourself. Governments tell us that they need more doctors, and yet they try their hardest to work against this. So why don't we make this easier? Why don't we make it so that there truly are doctors who can freely move around and go, so there's a free movement of labor, so doctors can move beyond the borders. So when a doctor does have to move to another country, they can still practice, and they're not limited to having the skills underutilized. I propose, and we all propose, that we have a system that allows for truly doctors without borders. Currently, the main issue with all of these barriers to entry is that the quality of doctors may not be enough. We are worried that maybe in a different country, the university would not give the suitable training. But this issue is non-existent because doctors ultimately still need to get the training inside hospitals. Even if you can doubt the quality of knowledge that's taught by the schools, ultimately these doctors still have to practice inside hospitals. And the practicing inside the hospitals gives them experience to allow them to be actual qualifying doctors to be able to, who should be allowed to practice anywhere else in the world. But okay, governments are worried. So to address this issue, why don't we create a third-party organization that creates an international diploma that allows all these doctors to take so that they can reach a certain quality, that they have the certain amount of knowledge that is required, and therefore they can freely move across all these countries. And on top of this, this will make it so that people are now more willing to become doctors. If you are someone who comes from a more international family and you do not know where you will end up, and as an international, and coming from an international school, I see this a lot, then this means you will now be able and willing to go for medicine, as the previous worries of, after I become a doctor, I might not be able to practice in the country that I now live in. So this increases the competition of people applying for medicine. And increasing the competition, well, the quality of doctors also increases. And this only increases patient care quality. And ultimately, this can allow for better quality of care for all of these people. Now, obviously, something that everyone will consider is, well, specialization. You've mentioned specialization. So how does that work afterwards? Well, specialization, I think, is actually adding on to the international diploma that I'm suggesting, as considering many different countries have their own specific issues. Let's take Australia, for example. Skin cancer is a huge issue in Australia due to, well, the hole in the ozone layer. And all these doctors are extremely experienced with dealing with skin cancer. And yet this expertise cannot be shared with overseas because people are not able to practice in other places. They are restricted to their own countries. But with this new diploma, people are able to go to other countries. They're able to experience and get all the expertise from other countries with all the special things that the other countries offer. And this only allows for all countries to share the skills of their doctors, improving the quality so that everyone gets access to these high-skilled doctors. And ultimately, think about it. When you go to a university, what is the most competitive subject? It is ultimately still a dual degree program that allows you to go to all these other countries because you want to experience different things. And it is the experience that everyone values. So maybe you're sitting there and you're someone who loves technology and you've heard AI, AI, AI a lot. Why can't we use artificial intelligence to solve all our issues in healthcare? Why can't we replace all doctors with a humanoid robot who does it all for us? Well, doctors will never be fully replaced by artificial intelligence. Doctors have empathy, have human connection. Doctors are the people, and you will have to trust a doctor. Ultimately, we will all trust a human who has the sense of judgment over a program, who is able to run an if loop multiple times. So what does this technology bring? This technology does bring something. It does bring tools. We now have AI incorporated in doing minimally invasive surgery. Minimally invasive surgery was impossible in the past as we were unable to see through into these smaller areas. But now with technology advancements, we have cameras, we have artificial intelligence that can help suggest to the doctor, is this what you're looking for? This makes it easier for the doctor to work, and it makes it so that the chances of medical errors occurring is lower. But it also means that the doctors have less workload. Admin work is decreased. Everything becomes easier for doctors. And yes, technology should be heavily invested in, but it will never fully replace doctors. So ultimately, I guess everything I want to say today is that, yes, there is a shortage of medical professionals. But I don't want to be someone who just highlights an issue. I want to tell everyone today, and I want everyone to take home, that there is a solution. Every problem has a solution, and I'm here to offer, and I've suggested the solution to everyone. And I hope together we can truly have a borderless community where doctors can really move, where no one will ever have to face the unfortunate feeling of loss. And maybe together we can strive towards this better future. Thank you.